Hey, it's Jessica DeMassa with WTF Health. What's the future of health? I'm talking to the who's who of health tech and healthcare innovation. And today I'm checking in with Arif Nathoo. He is the co-founder and CEO, I would say, is one of health tech's most successful real-world patient data and analytics companies, Komodo Health. Arif, great to have you here.
Hey, great to be here, Jessica.
All right, so we are going to talk not only about real world patient data and how that's changing the analytics game. We're going to talk a lot about AI, big data actually becoming a real thing in healthcare nowadays. And, also I'm going to get some news from you on a product launch. So you're building on the base that you guys have started with, your 330 million patient data points, patient journeys, including everything from like genomics, EHR data, claims data, all that good stuff that you guys have built over the last almost 10 years. Built on top of that, you got your healthcare map, and then now you guys have launched MapLab, which is really cool. Saw a bunch of different demos of it, did a lot of reading about it. But I'm going to find out from you, exactly what's new with this product. But before we really get into that, Arif, like I want to back up for a second, for those who may not be super familiar with Komodo Health and what you guys do. And I think this is actually like your business is run in parallel with the way that like healthcare analytics has changed and healthcare intelligence has changed over the years, because I remember like 5 years ago talking to you and like I'll be honest with you, I had no idea what you were really talking
You're
about.
like,
I
what
don't
do
think
you
I was
do?
allowed
I remember
to
you're
tell
like, okay,
you.
can you
Like,
explain in English what you do? Can you
uh-huh.
try again in
Yeah.
English? Yeah,
I
I know.
remember
It was like
saying
that. I
that to
get
you
it.
actually in an interview. There is probably historic
Totally.
footage we could look at of this. But I think that this is really marked though. Like I'm thinking back on it, and it's like now though, everybody's talking about analytics, everybody's talking about AI, everybody's talking about real world data. And I think like it's interesting how your business has grown kind of along with that. So why don't you tell us like if you could give us like kind of a short summary here of like what's changed really, for healthcare analytics, and how has Komodo kind of grown up along with that?
Totally. So thanks so much for having me again to talk about this. This is absolutely my favorite subject to talk about in the world. So 9 years ago, we had this thesis that like the biggest challenge to like data and using data and healthcare was actually not the data itself was, but making sense of it, like actually getting an answer that you care about for a problem that you care about. And so we built this one application. It was called Aperture. And Aperture solved one problem, which was like, for any given disease, tell me which doctors matter. Like, which doctors really matter. And when I say matter, I think about this from like the perspective of who's generating the science, who's seeing the right patients, where do patients get referred when they have really complex cases. And it's really hard to know who really matters. Like there are a lot of doctors that treat multiple sclerosis. There are a handful that really drive a lot of the senior decision making in the space. And it's like, but if I wanted to know that, I don't have a lot of easy ways to do that. I go hire a consultant. They go buy some data. They go do this big project. They give me a list of doctors. They're like, here's the list. And then by the time they give me the list, like something has changed. And we sit there thinking like, wow, like this is a problem that technology can solve. So we built this application. We called it a full stack application. And by that, I mean, I go from the data through the analytics. There was no such thing as AI. There was big data. There was the big data. And on top of the big data, there were some analytics. And from the analytics, there was an application. Analytics. Yeah. And it was like, oh, what's an analytic? It's something you do in Excel. That's when you take two numbers and divide them. That's an analytic. And we were doing that in like an app, in a software application. And I don't even know if they called it apps back in 2014, but this was our, web-based application at the time. And the whole notion was that we could actually do all of that work and present an application that answered a really fundamental question. And we loved that. That process worked. And for us, really the work that we were doing was in service of our mission, which is to reduce the burden of disease. If we could make insights accessible from this crazy amount of healthcare data, people will get better. Why? Because we improve care pathways, we improve the way that patients access care, we point out disparities, we start to do the work of healthcare. And that really put us on the map, and we started the process at that point of like, people were using this application, they loved it. We started the process of then saying, hey, maybe we should get more and more healthcare data that we could actually drive to insight. And so we started to build this thing up that we call the healthcare map, which is, as you described, longitudinal data on over 300 million patients in the US. And then over time, we started to spin out all these other applications that help identify and understand disease burden at scale and solve a whole bunch of different problems in healthcare.
All right, so you guys are still in the business of answering questions, right? If for as far
Totally.
as like healthcare is concerned, but like the stakes have been like up, and like the way that you're
Yes.
doing it is completely different now. So it's like, how cute was this? Like, I just need to know these doctors, and now it's like seeing some of the data that you're able to comb through. I mean, and just like what's in it, like I said, claims data. You're looking at EHR data. You're looking at social determinants of health data. I remember when you guys added that in, and that was the first time that that was being used, in conjunction with all these other data points. So, okay, so now let's talk about MapLab and what's sexy and new here about how you guys are answering questions. Because the cool part about the demo that I saw is, you're using this, and I'm not sure if you're gonna have to stop me if some of these features are not like ready for prime time yet, or if they are, but it's like somebody can type literally into Slack, and using your software running in the background, or the query that was pulled from it, ask it questions in English about the data set that you're working with. And I was like, this is like so different than how research and how data is being analyzed in healthcare today. But you tell me a little bit more about that. So talk to me about the new features of MapLab, in particular, that really cool one that can be, make the data usable in Slack of all things.
Yeah, no, it's a great question. So we're 9 years into the journey. We celebrated our ninth birthday, and
Happy
every
birthday.
year, thank you, we really have gone deeper and deeper in the analyst's workflow. And so, to your point, the first application we did was just finding these doctors, and it was a very fixed workflow. It says, hey, here is the world in a given disease area, and we've modeled out all these things. We modeled all the characteristics. We sort of set the different factors on what matters, and then someone can like go through a workflow of identifying, discovery, identification of different doctors that have different properties. But over time, you realize that, like, as we've put out multiple applications, that what people really want to do is that the questions that they're asking are so broad and so deep. And you want to go from like tooling that really is fit for purpose and answer specific questions to really the right kind of sandbox application, which allows people to ask anything. And that's exactly what you're seeing,
Yeah.
which is people being able to ask anything. And so MapLab, it really is the culmination of like all like 9 years of development that's really focused on creating a self-service application for people who are asking any question in healthcare. Now, asking questions in healthcare is hard, right? Think about this. If I say, oh, tell me about the MABs that service PSO and what the adherence rates are, you're like, what's a MAB? What's PSO? What's adherence? Like, each of these things have meaning and context. So I need a doctor who's going to tell me, like, well, tell me what a MAB is. Tell me how psoriasis works. And then you need someone who's like a coding expert to say, well, how do people like bill and code for, these things? And how do I know a patient really has this or not? And then you need someone's like adherence, like, well, there are 15 different ways to calculate adherence. And, let me tell you what they are, and let me develop a mechanism that allows you to search that. So you need all of that. So that's three different knowledge bases. That's like a doctor, that's like, kind of administrative expert that really understands healthcare coding and billing. And then you've got someone on the other end that's like really a data scientist that understands healthcare data science. And now, like, if you ask that question, just because you've got great questions, well, you're going to have to hire an analyst. They're going to go back and look at data. It's going to take you weeks to get an answer. And what if we could bring that experience to someone who can actually just do that themselves by leveraging the power of generative AI, trained on years and years and years of content that we've developed and built within Komodo? And I think that's really the power of MapLab, with really bringing all these things together and creating a user experience that's completely different.
So I like the value prop here on this is that it's like the speed with which people are able to like ascertain answers, and then also like the self-service nature of that. So say a little bit more about that, because it's like I think you've done a great job explaining at high level, but like tell us a little bit more about some of the features of this, because it's like there's a lot to this that like to me it's like I'm like a fake tech person, but like somebody who's really into the technology, like I'm blown away that you can do this, because I've sat through demos throughout the years of pulling the data and seeing it, and it's not nearly as, understandable by somebody like myself um, as this was. So to tell me a little bit more about some of those features that really do, contribute to this ability for people who are in life sciences orgs or in healthcare companies to like, whether you're, I mean, like whether you are like somebody who's used to doing like data analysis projects, or if you are somebody who is, in marketing and just wants to, pull this stuff out, what are the features that you guys have really made sure to build into this so that it is usable, self-service, no matter what the level, and also that the data is being brought to the person who asked for it in like a really timely fashion? Because I understand that the slowness of getting these queries answered, by comparison with other services that are out there is pretty lengthy.
It takes weeks to get simple answers in healthcare. And I think that's really the plight of a lot of data analysts that work for a big payer or a life sciences company. And then imagine you're at a big pharmaceutical company, you work in the commercial operations department where you have to perform all these analytics on how a brand is potentially performing versus its competition. And you've got folks on the clinical side that are like really trying to figure out whether they're going to recruit the right kinds of patients for a clinical trial. And we really know these folks because that's who we are. Like, we're people who answer these questions all over and over again. And the current standard of behavior is like, oh, I'm going to go hire my favorite consultancy and they're going to go do a multi-week project and they're coming back and give me an answer. And so that's what these teams are doing left and right. And there's billions of dollars spent every year going out and hiring consultants to answer questions, when what you described, the marketers just like, just tell me, am I losing like the 65-year-olds because they really have a bad experience on our product? Well, it's very knowable, but it's got to be knowable in a faster cadence than I'm going to run a 4-week project with a consultancy to answer this one question, because that to us is really what's killing the speed of healthcare right now. We can't get simple answers to really simple questions because the process is actually really hard. And so what Komodo's tried to do with MapLab is distill that process down into something easy. I think we all learned that when you ask ChatGPT random questions, it never says to you, you can't ask that. I mean, it does, but it doesn't for like the majority of things that you ask it that you can come up with. And I think that was like such a mind blown moment for a lot of people, that it was like, well, you didn't put the query in this way, so I can't possibly answer your question. It's going to try to answer what it hears because it's learned from tens of thousands of queries that have come before you. And similarly, when you train an LLM by looking, a large language model, by looking at all the different hundreds of thousands to millions of healthcare queries that have been run on Komodo software over the years, you can learn a ton about how people ask what questions, and you can create ways to kind of use our APIs without you being a programmer. And so that's really the power of bringing these two worlds together, which is to say, people have questions, very simple questions. Can I create a better user experience that takes this down from 3 weeks, with MapLab to like 2 hours? And then with like Gen AI to just a few minutes. Like, there's like a really wonderful cascading of the experience when you can bring these different technologies together.
Yeah, I mean, I can't. If I had to wait 4 weeks for my question to be answered, do you know how many times I would have changed that question? Like,
Yep.
I
You're
need
like,
like
I'm done.
instant
I'm
answer.
done. I'm
Of
on to
course,
my
I
next
want to
one.
ask
What's my
it. No,
next
I'll
one?
ask it
Yeah.
this way. Yeah, I'll ask it this way instead. I could never do that. Okay, so I want to ask. Here's the question. I want to ask about the data, RF, that you're pulling, that the queries are going into, because you had mentioned that over 300 million, patient generated data that you guys have access to, but like, it's not just that, right? I mean, organizations that you're working with can add their own proprietary data into the mix if they want to, right? Like, tell me a little bit about the data set that you guys are querying against.
This is like a very apropos. I'm at this conference called the Future of Health Data, right? They put this on every year. I'm here. There are hundreds of people here. 3 years ago, 4 years ago, it was like a group of 30. And we were like the data nerd pioneers. And years later now, like hundreds of people in this room. And I realized like what has happened is this like great consciousness to exactly where you started with, like, I didn't know what Komodo does, and now I can kind of appreciate it. It's because there's this incredible movement of folks who are like, wow, I've got data on this population. I'd love to really understand them. But the problem is, for that person that's like, you got this really cool app, you're like collecting all this great data. These patients are like, we really want to know, like, is this workout helping me get better, or is it addressing am I spending less on physical therapy? Because guess what? Like my payer is really interested in that. Maybe they'll cover this app if I'm spending less on physical therapy, if I'm using this app. Well, it's really hard for the app owner to know because they're like, what? How do I get this data? What happens to this patient when they show up at the PT's office? I'm not entitled to that. And so HIPAA's created the de-identified pathway to allow people to study populations at scale for exactly this reason. If I'm an app developer, I've got this 10,000 patients on my platform. I want to know, are these 10,000 performing better? Meaning, are they utilizing the healthcare system in a better way than 10,000 random patients that have the exact same conditions that are not using my app? So this is a study. This is like in classic parlance, we'd run a randomized control study and we kind of do it that way and like spend 2 years figuring out the answer to this question. In the modern real world evidence era, you can answer this question in like an hour. And so what's beautiful about the world is that we take our healthcare map, but what I do is on the fly match cohorts of patients. So if this app has these 10,000, I can study this 10,000. I can then compare it to any number of 10,000 other patients, and we can develop some conclusions on how well they're performing, and that can be done instantaneously. That's why Komodo exists, the power of doing real-world evidence at scale, quickly, by using the data and the technology to get you the fast answer. And I think that's the step change that we're starting to see, and people start to get that. They're like, oh, that would be really cool. And I think now it's like, okay, now we kind of understand why this healthcare map is so important. It really traces these journeys. It allows us to compare one population to another. It allows us to do that really fast, take out all the friction, and give us an answer that we can act on. To me, that's like progress for healthcare. And that's what allows us to go out there and say, hey, look, doing this will help you reduce disease burden. You get answers, you can act on them, patients can get better. How do we make that more lively? How do we make it happen? That's the work.
All right, it's progress for health data that you were at this buzzy health data conference. Like I told you, like, I mean, it's crazy how the game has changed for analytics and like healthcare data. And it's like, I think that this is just the beginning. All right, so since you're there, let's pick your brain about some of the hot topics and like health data. So one of the things I want to check with you, obviously everybody's like, oh, generative AI, and like, how is that going to change everything? And I was recently at an event myself with a lot of policy people and a lot of policy talk around this. And so I'm curious to get your take on this, Arif. So, one of the things about generative AI that, right now already is causing a lot of grief among the healthcare crowd is like, oh my God, we don't know what kind of data trained the model. And so I'm hearing a lot of talk about like, oh, well, could you create some sort of like food label that lists the ingredients that went into creating this model? I want to know, Arif, you're laughing over there. So tell me, what do you think about this?
That's great. Look,
What's gonna be the way that you can build that sense of like safety and security and like, risk averse healthcare that wants to know how is the model trained? Does it even matter? I mean, talk to me about this. What do you think?
First of all, I love that word food label. It's like, it's perfect. And it's really the government's answer to like every producer trying to like put wool over the eyes of the consumer. But now they all have to report things the exact same way. So it's like becomes like, a game of like manipulating certain lines, but there's only certain boundaries. I think healthcare is similar, but there's a slight nuance to this, which is to say that the hardest part of Gen AI in healthcare, well, there are two, and it depends on the kind of problem that you're running into. Number one is like when you have a hallucination. This is a term when an LLM makes up a fact, and it makes up a fact because it's just trained on so many things that it doesn't know. And you were like, hey, give me 10 great things to do in New York, and 3 or 4 of them just aren't even in New York. That is okay, because the worst thing I lose is a little bit of time trying to chase that thing down that doesn't exist. But if I say like, does this patient have diabetes? They're like, yes, you have diabetes. And you actually don't have diabetes. Like that is a patient care issue. So that's like big problem number one is there's a much higher threshold for just information being accurate in healthcare as opposed to problems of our lifestyle, where the stakes are a lot lower, potentially they're a lot higher. On the other hand, the exact thing that you said is there's a lot of like where does this data come from? What's the trust and the confidence? So what's been really interesting is that a lot of people who have been spending time training LLMs have realized that the best way to get rid of hallucinations is actually to train it on structured data, which is the opposite of like training it on everything in the world. And that's really where the power of Komodo comes into play, which is that we have these incredibly structured, thoughtful data sets that have years and years of like curation built into them that allow people to use it. And again, all of our language models are trained on like our APIs and all the content we've built, and that's trustworthy content. And what's even better about that is the food labeling, which is that they can then cite everything that was used. So when it says, okay, the MAB, I pulled the following drugs and they are defined by the following codes, and it's all clicked through, like, here is the basis of fact for this. And then here's how I ran the query in the API. Here are all the steps I ran. Now, you as an analyst could be like, ooh, I'm going to tweak that, or I'm going to tweak that. And that's great because I've given you the power of transparency. And then you think about all the other things you said, like, well, then like, tell me about the data set, the characteristics. Am I trained on a sample that represents the US, or is it like 80% white? Like, it's questions like that. And that's what Komodo's healthcare map is really designed to be, a transparent instrument that says, your cohort looks like this. This is the patient burden you have. This is what they look like. This is where their backgrounds are. This is where they're distributed. And so you have all the demographic characteristics that help you build trust. And then you as a researcher can say, I don't like that. I want a different population. I want to change this population. And so transparency breeds trust. And I think we're in that world where we can pair Gen AI up with full transparency to get to that level of trust. And we think we're at that place where that's happening. And I think that's what's going to happen in healthcare, is that it's going to be required. We're going to need to see the references. We're going to need to see the metadata that says, yeah, you did this right. I think that's the power in this space.
Yeah, and it's smart that you know that, because like you've probably sat in a lot more conversations than I have, but I was blown away by the academics who are like, we're going to need to know exactly what was in this, because
Totally.
but it's like you had said, you set it up beautifully. It's like these can be matters of life and death really in healthcare. So you need to understand what created the algorithm that you're using. I totally get it. All right, the other hype up thing I want to hear about from you is tokenization. Like, there are a lot of those legacy data businesses that are saying that, the de-identification and tokenization, you're going to be able to like match up a patient over here with like their credit card data and their like street address, and then all of the other stuff that's like living in the, the EHR and like everything. And it's all going to be de-identified, and it's tokenization, and this is going to be the way of the future. Arif, what are your thoughts on tokenization?
We've been tokenizing healthcare data for 30 plus years. HIPAA is actually what generated tokenization. The only thing that has changed in the last 5 years is that there's been a heavy promotion and advertisement around connect your data to everything else, because we're going to give you this token for free. And I think that's what's really changed, is that historically tokens were controlled by a few companies, and you had to work with that company to use their token. Now there are companies that actually provide tokens that anyone can use on healthcare data. Now, unfortunately, a token does not mean that the HIPAA standard and privacy is guaranteed. And that's the thing that everyone gets trapped with, this idea, oh, I can commit your street address and your credit card score to your healthcare data. No, you can't. There is no certifier on earth that will look at that and say, yeah, that sounds great, because statistically, you are likely to be re-identified. And so the beautiful thing about the system is that tokenization itself is not a panacea for anything other than to enable parties to have these conversations. What sits on the other side of it is trust, compliance, safety, ensuring that data gets certified as de-identified. And then the use cases that abstract value out of that. And so the big joke about legacy aggregators is that for every dollar you spend buying data, you spend $12 trying to get an answer out of it. And so we sit there thinking, I'm like, wow, if we could just make that process easier, go through the compliance steps, automate the privacy, ensure that every piece of de-identified data stays de-identified, and then pull that through easy to use software and get answers quickly, 3 minutes, as we hope any kind of question can be answered. That would be the standard for what it takes to actually create value through all this healthcare data. I think there's just too much like hype and hope that somehow connecting data is all you need in order to get enormous amounts of value. We think that's very short-sighted, but guess what? Like, we exist to help kind of bridge the two and get ourselves to a much better place. But you're absolutely right. This is where things are going,
Right.
but we need everything else in place to get value.
Those are like the buzzwords of the year. It's like generative AI and like tokenization. It's like all of a
Tokenization.
sudden everybody knows these things. And like I said at the beginning, 5 years ago, I'm like, I don't know what you do at all. Can you just say it in English?
Can you
Like,
just
all right, I'm
explain
gonna
it?
need another example, okay? All right, so speaking of back in the day, let's talk a little bit about Komodo the business. Because like you said, you guys have been around for 9 years. Like you're like one of these, you're a typical health tech startup in it for the long haul to be an overnight success. Let's talk about the market right now, because I mean, like we know things have been not great, especially last year and this year. And you guys, what's interesting to me about what you and your co-founder Webson did was that you guys made some tough decisions really early. Like it was like 2021, and you guys had plans to IPO in 22. Like you guys were set to go, and then it was like okay, and like you made some adjustments for the business. So tell me how things are going now. Like, like those decisions that you made back then, like how have they impacted where the company is at today?
Huge decisions. And I
Yeah.
would tell you that, like, as founders, you never want to feel like you're making decisions because you have to. You always want to feel like you're making decisions because they're the right things for your business. And what we were seeing in the early parts of 22 as we were moving through the year was that it was going to be a tough year, and that toughness was going to extend for 2 more years, like easily through 23 and 24. And so you make decisions based on what you see coming up in the future. And I think by the time you make decisions too late, then you're just at the behest of the market. And I think as founders, it's incumbent upon us to like take the hard calls, even if those hard calls are not super popular, even if they like lead others to sort of disagreement with us. But at the end of the day, that's what makes us, like what we are. And that's what allows us to survive tough periods like we're in right now.
Yeah.
So just being able to make those decisions proactively, recognizing that the hardest thing for a company like Komodo to do is to say goodbye to a good dragon. Like a dragon is someone who really
Oh,
devotes their life to the mission, to the cause. But we realize that in the long run, the business is successful because we have a group of really passionate people that are around us, and we're building a business that can scale no matter what the capital environment is. So that's been kind of our attitude. And all expectations aside, it allows us to actually continue to be on our mission and keep our focus on the things that matter.
all right, generally speaking, let's wrap it up with this. I want to hear, because we are in this health tech downturn, so like, all right, tell me, we'll start with the bad. Like, what's like the dark cloud of like having to operate in this market downturn? And then I also want to know what the silver lining is. Because, I mean, it's like we're literally, quote unquote, and this is such a bad pun, weathering this, right?
We
We're
are.
weathering this. And so it's not all, I mean, like any kind of change, it's not all bad and it's not all good. But I want to hear from you, as a founder, and as somebody who's kind of, like you said, made those tough decisions early, still on a great path, on an awesome trajectory, launching new stuff, headed into next year, optimistic about like, what's going to happen next, still killing it. Tell me, as far as just operating in this market downturn for health tech, dark cloud, silver lining. Go ahead.
Yeah. Dark cloud is that so many great health tech businesses just will not continue to get funded or make it. It takes capital to win in this space. And unfortunately, a lot of good businesses aren't going to survive. And I think that is a sad thing for health tech. Everyone's like, oh, well, the cream rises to the top. The companies that found profitability rise to the top. And I think that that's very, very short-sighted. Capital exists to fund businesses that should run at very highly negative margins for years to build the business. And health tech needs that love. It needs the capital. It needs the investment because these things are hard. These problems are hard. The people they sell to are highly entrenched, and it's impossible to drive innovation unless you spend money to get benefit. And so I think that is the dark cloud we're in, seeing a lot of good businesses struggle and not make it because they have to push to profitability or because they just won't get funded in their next round. So that's the dark cloud. The silver lining is that this change, this very profound, transformative change for how healthcare gets done is here to stay. Every provider has to accept the fact that customers don't want to come to your crappy hospital. every payer has to accept the fact that your margins will never be as good as they were in COVID when nobody utilized the system. And if you can accept those two facts, healthcare will get better. But I feel like people still live in the reality, like distortion field of how they've been patterned to think. And a lot of change is going to shake up the industry in the next 5 years. And it'll be very interesting to see who evolves and who adapts and who kind of stays behind. So we think that the good part of this is that the shakeout will actually drive a better cognizant realization that the consumer is taking so much more control of their healthcare, which is a huge positive for society. But now, like, we got to do the work to bring it to life. So that I think is the silver lining.
Great answer. Thanks, Arif. That's seriously great. I had chills on the first one and the second one. I'm like, yeah, wake up. It's a new day. Mortgage rates aren't going to be down that low again either. I mean, we're all living this, right?
We're all living this change. Like, get over it, move on.
I get over, yeah, like, yeah, forget it. This is not the new normal. This is just normal now.
Exactly.
Arif, I mean, like, seriously, think about it. Generative AI is like a thing that everybody knows about. Who saw that coming? We're living in that reality
a year ago,
too.
we didn't even know. Like, we weren't talking about it a year ago. A year from now, our vocabulary will be totally different.
Oh
So
my God.
it's just amazing how much of a change we're in right now. And I kind of liken it to like when the internet came out, in the like mid 90s. It was like this massive explosion of change when all businesses like completely re-architected how they operate. I think we're going through the same thing for the next few years for sure.
Awesome. Well, Arif, it was a pleasure to talk with you. I'm gonna have to check up with you again, see how things are going, maybe like early next year, see what's new over there at Komodo. But thank you so much. And thanks for
Thanks so
talking,
much, Jess.
trends
Yeah.
too, and some of this stuff that I think a lot of people are going to be really interested in understanding a little bit more about what's happening with some of those big data buzzwords. So we'll let you get back to your conference and network and schmooze with the hundreds of people who are there this year. Before it gets too busy next year. Yeah. Well, thanks so much, Arif. Thank you again.
Thanks, Jess.
All right. For more interviews with the people who are changing the way that we do healthcare, you can head on over to my YouTube channel and check that out. I'm Jessica DeMassa. Thanks so much for joining us. That's Arif Nathoo. He's the CEO and co-founder of Komodo Health. We'll talk to you guys again real soon. Take care.